We're digging deeper now into the issue of traumatic brain injuries. This is after autopsy results showed Cullen Finnerty died from several factors, including complications of a degenerative brain disease often found in athletes. And we told you about this at the top of the hour. Now we're taking this further to find out what's being done to avoid these types of injuries. I'm joined now by Courtney Vandewege, athletic trainer for East Grand Rapids High School. Courtney, thank you so much for being here. Such an important topic.
Yes.
Now, we know that in 2009, there were statewide regulations that went out.
Right.
But what do you guys do in East to go beyond that?
We started 2 years ago using a program called Impact, which a lot of other schools in the area also use. All the student athletes sit down and take what's called a baseline test, and that tests them at their normal. How are they every day, day to day? And it's not a fun test to take. They check.
They do that at the beginning of the year?
They do that at the beginning of each sports season, and they do that as a freshman and as a junior.
That way you're tracking then what they started with normally.
What they start with normally, and then anybody who has a suspected head injury will then retake the test within 48 hours. The test then compares their scores, and if they're within the normal range, they don't have to take the test again. If they're not, we continue retaking it until they get within their normal range. And then along with that, they work with the athletic trainer on a day-to-day basis with their symptoms, making sure that those are going away, because the test isn't the end-all be-all. They've got to be back to normal as a person, as they're behaving, you know, their normal behaviors and things like that.
Just to make sure they're being tracked and everything.
Being tracked, and we're making sure they're getting better. Or if they're not, that we're going on to the next step to do whatever they need to do to get better.
Now, right now, we're seeing football video, but one thing we want to get out there, too, we're not just talking about football, though.
No, not at all. Our kids take the test whether they're a swimmer, a cross-country runner, a football player, soccer's huge, lacrosse, every single sport, because you never know when a head injury could occur.
And also, too, this goes beyond just when the players are out on the field, doesn't it? I mean, we're not just talking about, okay, so when you're playing, we need to really be careful out there. This is what we need to be thinking about. But this also goes towards strengthening, training, even down to the uniforms they wear, right?
Some of it does, yeah. Yep. We look at, biggest thing in football is does their helmet fit properly? One of the misconceptions out there is that a helmet can prevent a concussion. They can't prevent it, but they can do a lot to make it safer. So we need to do the best we can. We do a lot of neck strengthening at East Grand Rapids to try to prevent those injuries. But we even go deeper into dealing with the counselors at school if we have to, making sure the kids are doing well in school and they're coming back from the concussion, not only as an athlete, but also as a student.
Now, you know, we have so much about the trainers and making sure that the trainers know exactly what to keep an eye out for.
Right.
Are you also talking to students to make sure that students know the symptoms, what to look for, to keep an eye on each other?
I know personally in my athletic training room at school, we've got posters that go through all of possible concussion symptoms, and I'll get goofy questions day to day, you know, do you really feel this? Or I feel dizzy sometimes just walking around. You know, and it's one of those things where I have a huge open door policy in my training room. I want them to come in, ask me questions. If you feel kind of funny, tell me. Not everything is a concussion, but in this day and age, we need to be careful and make sure that the kids are comfortable coming in and talking to those medical professionals that are available, and if not, that maybe even they're talking to a teammate. Hey, I don't feel quite right. Have you ever had this before? You know, and sometimes it's the teammate that walks in my office and says, hey, so-and-so's not acting quite right. You might need to check on them. And that's awesome. And that's something that is very, very important, and I'm glad that kids are comfortable doing that.
Courtney Vandewege, athletic trainer with East Grand Rapids, thank you so much. Such important things to know. Now, still ahead, we're going to the other side of the issue. When these injuries have already happened, what kinds of conditions can they lead to? How are doctors treating concussions now? We'll be joined by a concussion expert from Spectrum Health coming up at about 5:40.